Okay, so I'm here to talk about a huge gap in mental health services. You have this whole thing right in front of you on paper. So I figured I'm covering a lot of stuff and it would be easier if you could read it later too. And this gap in services is affecting my son and a multitude of other people. Hospitalization and even sometimes the jail can help stabilize mentally ill patients. However, upon discharge, these patients are simply returned to the community. There is a need for long-term, permanent, structured, and supportive care to help these patients maintain stability. Without the care, it becomes a revolving door from the community back to the hospital or the jail, which is costing taxpayers a lot of money. Even though I am a licensed psychotherapist and I have tried everything I can think of for my son, nothing has stabilized him. My son Zach started having problems when he was 13 years old. And I think I will skip over some of this. I wasn't aware of the 5-minute limit, but I'm sure you can read some of this history about him. He was fairly successful as a young adult, almost completing several programs, Red Rocks Firefighter Academy, but he wasn't able to obtain a position after he finished it. He was just a lesson or two away from having his pilot's license at Air West, and he was just a few credits short of bachelor's degree in music at Metro State when he was first hospitalized in 2007 at 26 years old. The next paragraph, I think the main thing I want to point out is that he's had this illness for a long time. He doesn't have any insight into it. I've tried to provide him with private providers when he didn't have insurance, and tried to do what I could along the way to keep him going. He took on a whim. He went to Los Angeles because his therapist at the time said, "You want to go to LA and do music? Why don't you do that?" So he did. And just without any resources, he was in and out of the LA jail and Orange County jail many times. And even though I was in touch with the jail psychologist, she couldn't do anything because Zach didn't think he needed help. So the next paragraph, the main thing is he committed some crimes. And because of that, he was put on probation. So I purchased him a car so he could get down to Douglas County to keep his probation appointments. And that, we've kind of limped along through lots of probation and things like that over the years. But it really is just limping along. It's not fixing anything. So his second hospitalization, the first one, I was in the first paragraph. I didn't mention that when he was 14. The second one is in 2007, and he's been on Medicaid and Medicare and Social Security disability ever since then. Jefferson Center for Mental Health has been his payee and provider of mental health services. He's also been hospitalized at Centennial Peaks and readmitted to Fort Logan in 2012 and 2013. He's been held on a hold at St. Anthony's Hospital and Boulder Community Hospital. He's been in and out of jails in LA County and Orange County and Douglas County, as I mentioned in earlier paragraphs. But he's also been in Denver County Jail and many times in Jefferson County Jail. I was able to get his Lakewood rap sheet, and he had 46 arrests in Lakewood alone. So there's been many, many times he's been in and out of the jail, and we've gone through all this. If you add the other counties to it, the number would be much, much higher. Okay, all of his convictions have been misdemeanors. He's currently charged with a felony, but who knows what will happen with that. Okay, so prior to his admission to Fort Logan, I bought him a condo. However, within a few months, he went off his meds and was using substances. He was placed on a mental health hold. Upon admission to Fort Logan in 2013, he was initially described as dangerously impulsive, angry, unable to cooperate, verbally abusive, hypersexual, agitated, pacing, threatening to staff, delusional, and paranoid. So that's when he decompensates. What's going on? His diagnosis is schizoaffective disorder. Many of you probably already know what that is. In Fort Logan, discharge report 2 months after admission. And I'm quoting this off of the report that I got. Let's see. It was stated that he met his treatment goals. He has shown appropriate interactions with staff and peers. He is sharing a room with other patients and has generally been pleasant, social, and a good role model for his peers. What a difference. In 2 months, they were able to stabilize him. But without a change to the gap in services, he just goes right back through the same thing again, over and over and over again. He's currently in jail. He was arrested on July 22nd. He had heard voices of a farmer telling him to go into the Dollar Tree store and get some juice. So he did that, but he didn't have any money. So as he was getting ready to leave, the clerk, I think, tried to stop him. And he apparently, I don't have the full detail, and they wouldn't give me the police report, but he apparently tried to raise a stick or something, and somebody thought it was a hammer, so that's what made it aggravated robbery. But that hasn't come to anything yet. So on September 23rd, he was declared incompetent by the state. So he's been sitting in the jail ever since then. He's still there. He's very psychotic right now. Let's see, did I leave out something else important? We've been told that it might be 4 to 6 months before he can get a psychiatric bed. And in the meantime, he's just psychotic. You know, he's delusional, he has hallucination, he hears voices. Okay, this last part's really important, so I want to keep going just a little bit. The Jeffco Jail Director of Public Affairs, Jenny Fulton, had a deputy call me and let me know that it costs $84 per day in the jail. That's over $2,500 a month for someone to be housed at the jail without any treatment. And Becky's colleague, Dr. Matt Salbenblatt, is a psychiatrist also at Fort Logan, and provided information that costs $821 per day at Fort Logan, or over $24,000 a month for each patient at this facility. I think we can be more responsible with our taxpayers' money and have a better program to take care of people like my son. So some ideas that might help. Housing first. So this is ideas to provide housing first to help stabilize the person, then begin treatment or whatever is needed. Permanent supportive housing is a permanent place, so they're stable. They're going to have a home, they're going to be in this place, and supportive services are available 24/7. Structured programming of regular daily activities, regular schedules, chores and work, opportunities to earn off-campus activities, but not necessarily a totally unlocked facility. Substance abuse treatment on site, medication monitoring, and etc. A semi-confined treatment facility. I don't know, I don't have the answer for all of this, but some kind of a locked facility at least part of the time so that they have to earn to go off campus, and then there are consequences if they don't follow through with the rules or whatever. He does well in jail when it's structured. You know, he gets his 3 meals a day, and even when he's had to work towards getting an earlier release, he can do that. He could do that program, you know, in a structured way, but not on his own, independently. And then peer specialists could also be a part of a program like this. And then, as Becky knows, and she can speak to in a second, there are buildings on Fort Logan's campus that are empty. They could be used. We just need to get started developing that kind of a program. So while I'm a retired licensed psychotherapist, I've never had answers. I've tried many interventions with my son, with the support of professional colleagues, but within the current system, he continues his perpetual cycle of release to the community, then back to the jail or hospital. I have supported him financially while he lives in West Colfax motels, and I buy him food. His benefits don't cover enough. They cover very little what it takes to support him. I have managed to keep him alive, but I can't do this alone, and it's going to take a whole group of people like you all to develop something like this for this population. Since we have began deinstitutionalizing inpatients in the 1970s, we as a society have abandoned those with significant mental illness. I'm sure back in the 70s, my son would have been institutionalized. He would have been in the hospital, and I'm not saying everybody needs to go back to that, but there are people who do. It's time that we let the pendulum swing the other way as we begin to care for these individuals again in new and innovative ways. Thank you.